So thank you for having us. I am Dr. Bowman, and with my husband, Brian Lebeda, we have Pioneer Vet Clinic. I wanted to give a little bit of some background. I'm originally from Jennings, Louisiana, which is in between Lake Charles and Lafayette. I'm actually an honest Cajun that's from south of I-10. I spent a lot of time in my junior high years and high school years actually in Oklahoma. Through 4-H and showing livestock, I spent a lot of time and ended up going to Connor State College in Warner, Oklahoma. I from there went to the University of Arkansas, got a bachelor's and master's, and then decided I might go to medical school. Did some cancer research at Arkansas Children's Hospital, and then decided that I couldn't maintain a 4.0 with organic chemistry 2. And got really scared I'd never get in, and I needed to make a life change, and I was like, well, I'll just go to vet school. And that actually now sounds so crazy because the application process and the easiness to get in is ridiculous. I did get in my first time around and went back to my in-state school of LSU. I graduated in 2012 and then went to work in Northwest Arkansas. I worked for Pea Ridge Veterinary Clinic for just less than a year. I learned a lot. I've always been someone that learned by fire than mentorship. I got thrown into a small animal clinic, even though I wanted to be a large animal vet, and my boss left, and I ran that practice and learned by making mistakes. And then I decided, well, I need to stop working this hard for somebody else. I need to probably work for myself, or I needed to change direction. So I looked at a broker site, and I found Taylor Oldfield Veterinary Clinic. The clinic actually was started by Dr. Taylor, and then his associate, Lad Oldfield, bought in 1980. The clinic looked like a gold mine. When I was trying to get all the paperwork to give it to the bank, I saw the amount of loyalty that the community had to this clinic. I knew my biggest hurdle was to be able to keep those clients and keep those patients, because I'm also from a very small town, and when somebody comes from another area completely and there's no ties to a city, it can be really tough. One hurdle that we also had to overcome was it was an aging clinic. This is a very old building. It's older than myself, but it was still in great shape. But we also had dip tanks for our x-ray. We had a DOS computer system. We had a dot matrix computer. The blood machines were from the late 80s, early 90s, and you had to hold your mouth just right to make them work. And so those first 3 months were very tough because, like I expected, it just got really quiet. But I would consider the next few years, from 2014 to 2020, as one of those like slow growth, lessons learned type of periods. We upped the technology, we made a lot of changes, and with changes comes growth pains. And so we went through 100% turnover of all the staff, and we continue to have some turnover because I was needing people immediately, and I was hiring bodies. And starting in 2020, my husband and I decided we needed to change. We spoke about our goals. We wanted to know what direction we were going in, and we knew we had to make changes. And we decided we had a new dream, and to get to where we wanted to be, we needed to change our culture. And we started looking not for people that just to work for us, but we want people that actually want to be there. We want to be a place where we care. We care enough to be good. We care enough to show up. We want to be at the clinic. We want to help these people, these patients, and these clients. And so we started looking for that specifically. And that really paid off. We really want to help our clients and patients using what we bring to the table and what the actual owner can bring to the table. And it's actually becoming more of not what our needs are, but what the community's needs are. After that really nice talk between Brian and I, all of a sudden it was February, and we started hearing about the word coronavirus, and then March showed up, and all of a sudden it's COVID, and we went curbside. And we were the first clinic to actually go curbside, which was really scary. We probably had 10% or 20% of our clientele was pretty angry about it, but all that actually was in the wash. They actually did a really good job. We developed a necessity to be transparent and use documentation, and that really helped. Our girls that we hired wanted to speak to the client, explain what we were doing, make sure that we're totally transparent while they're sitting outside what is happening in the clinic. We tried to bring telemedicine in. It worked really well for that year. It didn't stick with our community, but that's okay. We need to be able to change with what our client is actually asking for. I think COVID really also opened our eyes to what our building needed to be. That was also another part of change. All of a sudden, we looked at this aging building and realized it was brown and orange, and from the 70s and early 80s, and it was kind of gloomy. And we had this big building in the back we weren't using, and our kennels were concrete and they were falling apart. So we decided we would make a change, and I told Brian what I wanted, and then he made it happen. He talked to Shasta and Mr. Austin, and right at the beginning of COVID, we got a budget and we started working. Now, of course, we didn't know that prices were going to double or triple, but we are making it through that, and Brian has done an amazing job. So we went from 2 exam rooms to 4, and that allows us to not have a huge waiting room. And we took that monstrosity that was up front out, and now we have a fully functional 2 reception desk. And we paid homage to the old by putting 10 from our barn actually on it, and it works really nice. We try to keep those exam rooms full, try to keep everybody on time, and try to keep our clients happy, because nobody likes going to the doctor and waiting 30 minutes to 45 minutes. We started doing a lot more surgery. I don't know how that built up, but it did. And so we used to have this small little room. This is right after we bought our digital dental x-ray machine. And they're safe because there's just a little bit of x-ray on these. If there were no radiation, if they're taking regular x-rays, they'd be fully leaded. But it was a really small room, and now we have a double surgery suite. So we try to use our technicians as kind of like you would think of dental hygienists. They're in there doing what they're able to do, and then I play doctor or act as the doctor of assessing the patient, actually treating disease, and doing actually the procedures. One thing I really loved is we actually came up with the isolation room. Because our clinic was so dated, I had nowhere to go with a lot of our parvo patients and a lot of our contagious disease. Brian built this beautiful little room. It actually has access to the outside. So when these type of contagious pathogens are coming in, they do not even have to walk through the front of the clinic. We can just bring them through the side. They can go in there. We can start treatment. We're in Tyvek suits. Everything's fine, and we're not exposing our other patients to being sick. We didn't take a lot of pictures before. We realized that last night. But this is the old working pens that were behind the clinic, and you can kind of see the barn. It was huge, and it was not being used. It was starting to become like a storage facility. So we ripped that out, and we put this new building in. It contains 40 actual, what we call rooms of suites and standard rooms where we can house our boarders and our day boarders. There's actually indoor play area that you can't see. You can see my laundry room just a little bit, and there's 2 washers and dryers that do probably 10 loads a day, and they're nicer than what I have at home, and it's lovely. But we're really proud about also our outdoor area. We put in this AstroTurf out there. Brian laid the pad together. We went ahead and actually laid the fake grass. And there's a really good reason why that's real expensive when you pay somebody else, because it is work. But the dogs absolutely love it. It's a great place that when it's really rainy, like in the spring, not right now, we can send dogs to play outside. They play in groups or individually, and they don't get dirty, and they keep smelling nice, and they like it. And then we have like a little concrete pad that goes around it. And it's funny, the little dogs think it's their little walking area. It's just like they went to the park and they just go around and around. That's a group playing. And if you look past the fence, you can see where our road used to go around the clinic. We took that out because we had to build this little play area. But then we laid about an acre to half acre of Bermuda sod. And we're hoping to have that actually Fenced in probably after the first of the year, just having to work that little bit of our budget. And then we will never take a client's dog outside of something that's not contained. We're next to a big highway. We've never had that kind of accident with the girls, but we never want that accident. So it makes our clients more feel at ease if everybody's inside a fenced-in area. And Brian has some really special plans for that area too. And then we do have some current projects. So we've really learned a lot these last few years of where we want to go and how do we get there. So right now we're in the process of developing systems to make that happen. We want to have standard operating procedures that when I have one person out, another girl can take that person's position or another guy, and they can find out how to do that job and do it correctly and know what's expected. It sounds like that should be common sense, but when in a vet clinic, it's just kind of organized chaos at all times. So we're working on that, and we're trying to become our own interpretation of a turnkey business with that. Not that we're looking to get rid of it, but we just want to make it simple. And that's taking a little bit of time, just writing things out, but it's coming along. Our next thing that we're really working on is how to manage our growth with staff. Even right now, we're looking for a receptionist or customer service specialist, and to find someone that has some experience and understands what we need and be able to balance a whole clinic, because we see somewhere we have probably over 8,000 patients and over 4,000 owners. It's a lot, and finding somebody that's qualified and trainable, it's kind of been really hard. We use Indeed for the last 2.5 years. We've been trying to hire people constantly. We have these 3 girls that work for us. We hired them during the COVID epidemic. They're actually in vet tech school online because there's not a tech program locally. And with that, they can take on more responsibility because we want to be a team-oriented clinic, not a doctor-oriented clinic. We also have a really nice program here at Pioneer Tech with the Certified Vet Assistant program, and we're one of the clinical sites. We have hired people out of that program, and we hope to do it more often. We have an advisory meeting tomorrow, and we're really hoping to make some more, maybe put more structure in that clinical training so that when they come to different clinics, they have more of an expectation and they actually learn what they're expected to do. Our last thing that we're working on is actually community awareness. So even though the clinic has been there for over 40 years, I've been there over 9, or at 9 now, there are still people in our community that don't know who I am. They don't know where my clinic is. They don't know what services we offer. And even though we use, newspaper, radio, Facebook, we use every source that we can think of, we still are not meeting all of our community, and that's hard. We started using Ponca City Monthly here recently, and with new people coming to our community, it's actually starting to pay off. I'm starting to hear more people saying, we just moved here and we want to come see it. So that's actually paying off, but I'm open to ideas of how we do that better. That's kind of our story in a nutshell. If y'all have any questions, Brian and I would love to field them. Well, we started putting this together, and I was making these slides, and all of a sudden I realized 10 minutes was a short period of time. So there's not many, and we're not really good picture people. And so if you haven't seen it in person, come by. We don't mind giving tours to the public. We're trying to move it to about 11 and 1. Because at other times we're leash free back there. I mean, girls have leashes with them. Their animals are totally being supervised, but they're playing. And so when we open the door constantly, little dogs, they think that's really fun just to go from building to building. And so we want to make sure everything is safe and we're doing it correctly. So if you want to see it, just call or just show up during those times, and we can probably give you a nice little tour. Yes.
I want to thank you for everything you do in Ponca City. You give Oklahoma State event you did a while back. That's really great how much you're giving back to the community.
We think giving back to our community is not only is it great for the business, but we know the importance of it. And a lot of these different organizations are helping, children and education, and we try to help ones that help with pets, but we try to give as much as we possibly can, and we enjoy it. Yes.
You also have grooming service.
Yes, I did forget that. We now have a full-time groomer. Miss Angie does an amazing job. She's been with us. We went through a few girls, but we finally found one that we really like. She can groom anything. She's quiet, but she is very efficient. And if you need a groomer, groomers are kind of like doctors. You have yours that you go to, but sometimes you get sick and you need to go somewhere else. If your groomer can't get you in, come try us. We have some openings, and she's amazing, and she's really good with the animals. We try to practice fear-free techniques, and if you don't know what that is, it's an organization within the veterinary world that teaches veterinarians how to handle animals correctly to where they have positive experiences with us, and it's not a scary place to go. And she's really good.
The size of animals, you guys do large animals and small?
Okay, so when we first bought the clinic, we did do a lot of large animal work. And in the last 9 years, that part of the industry has really changed. With the price of livestock and farming, there's already a very small margin, and a lot of producers, they do not call a veterinarian for consultation or a lot of things anymore. They're doing a lot of that work themselves. And so I was getting a lot of phone calls for things that we call like fire truck veterinary work, where the producer's already done everything that they can, and by the time I get there, it's a disaster. Which I love large animal work. It's what I wanted to do, and it was really sad when that didn't actually happen. But I am now over 40 years old, and I've already had one shoulder surgery, and I have extremely bad pet allergies and livestock allergies. Actually, horses are number one, and cattle are right there with it. So with COVID, we also got so busy that scheduling those phone calls are really hard. So we're getting out of that line. We are now going to be a small animal-only clinic. Yes, ma'am.
So what else can we do to help support you in your business?
And I've been forgetting to ask all the questions back. Okay. So what I need, or what we need for the clinic, or how you can help us, is just spread the word. The best kind of advertising is telling your friend. Like us on Facebook. If we have an event, come by. We always have food. Come by anytime. That parking lot might look really full, but you can find a place. We don't mind you parking in the grass. Just go ahead. But if you have friends coming to the area and they're bringing their animal and y'all want to go out to a game, call us, drop them off for the night so y'all can go have a great time and pick them up the next morning.
Can you explain that part of the product, like if you are checking an animal in, like for the weekend, or how that kind of works?
Okay, so we not only do we have full-time boarding, we also do daycare. So you can drop off your animal during the week anytime and pick up while we have business hours. If you need an early drop-off or a late pickup, as long as there's availability, we try to meet those needs. On the weekends, we do have actual staff that are there all day long. There's not a facility in Kate County that is 24/7. It just doesn't exist yet. So we have drop-off times that you can drop off your animal during the weekend. It's usually 9, 11, and 4. But my girls, if they know you're coming at a specific time, they can make any time usually work. But they are out with the animal. So there's not somebody that's actually right there at the front door to just field people walking in. But if you let us know, we can probably handle anything when it comes to that.
And do you explain that part of the product, like if you are checking an animal in, like for the weekend or how that kind of works?
Okay, so we not only do we have full-time boarding, we also do daycare. So Yes, ma'am.
I had talked to you earlier, but I just wanted to tell you that for my mom, she has a new rescue dog, and your facility has just been a game changer for her. She's kind of went back and forth if she can keep the dog or not, and I think your facility has allowed her to keep her because she does love my mom, just not my stepdad.
I mean, and that works, and that happens. And there's some other clients in here that have similar situations where the dog only likes one person and then kind of resource guards them. It's the perfect, if you have an issue like that, we can help. And you're not alone. Especially with COVID, we got a lot of animals or new pet owners that were staying at home with these pets, and then all of a sudden they kind of went back to work. And we're seeing some socialization and just confidence issues in some of these pets because they're not used to these big changes. We can help those kind of owners, get through those times. Day boarding with socialization and playtime, and just us teaching them some basics on, how to walk on a leash and how to do certain things. It stimulates your pet's mind and it makes them a better pet. And if we can't help you, luckily OSU actually just started a behavior department, and so they actually have a behaviorist now, and that is actually a godsend, and we can send you there. There is help. You do not need to get rid of your pet just because it has separation anxiety. There are programs to help you.